Do you want your longevity business to crush it this year? You are in the right place. Every week, we're diving deep into cutting-edge longevity science and profitable business strategies. You'll discover what's working right now for top clinics and get practical ideas to boost your own business. I'm your host, Brett Wallace, and this is the Longevity Loop Podcast. All right, welcome everyone. We are here with Phil from Web2Med and Vitadox. I've just recently met Phil through LinkedIn, a connection, and I thought it would be awesome to have him on the podcast because me and Phil are in very similar marketing situations, and Philip is going to give us a ton of actionable, awesome advice today for anyone that's running a medical clinic, specifically in the anti-aging or longevity health span space. So with that said, Phil, nice to see you. Thanks for showing up. Love your guitars in the background. Dude, I mean, such a fan. I love it.
Thank you. Thank you for having me. It has been an interesting journey, like you said, sure, similar interests and backgrounds in marketing. My journey has been long in a way. We've been providing marketing for this anti-aging longevity space for over 20 years. Started in 2001, just after the dot-com boom. I guess great or the worst time to start a business, depends how you look at it. But it's been an interesting journey because, from one, the technologies have changed. They change all the time. They change every day. But they change greatly. We've been creating websites much differently than we do now. There was no iPhones, tablets, all of that cool stuff that we have today. So
yeah, remember Dreamweaver?
Yeah, exactly. Or Notepad and or people creating websites in Word. Seeing that happen. So it's a much different time today, but I think that's what makes it interesting. The other part, I think we share that common interest is the longevity and the anti-aging space, and that industry has evolved and reinvented itself so many different times now. I remember when we started working initially for the Anti-Aging Academy of American Academy of Anti-Aging Medicine, A4M, years ago. The types of treatments that the doctors were offering and type of education is much different than today. It just has evolved, I think, even quicker and more than the web technologies. I know a lot of people don't necessarily see that because you really have to pay attention to it, but looking at what was available and what we've been marketing 20 years ago, it's much different today. But overall, I think we're in very exciting times, both from the web marketing perspective, which is much different, but also the longevity and anti-aging with the different modalities, different treatment options. We'll see what happens with the new administration, what type of treatments will be allowed that may not be allowed today. We spoke with a lot of people recently, and everybody's hopeful that, stem cells, exosomes, all of those options will finally get approval or at least be on track that, that approval will happen. So it's
Totally.
interesting times nonetheless. My journey, like I mentioned, with Web2Med has been traditionally creating websites and providing optimization marketing, driving patients to practices. But there is also another company we started. This is now back 10 years ago, called Vitadox. And that was to expand the reach of these anti-aging and longevity clinics. But when COVID hit, we gotten to be number one for COVID testing locations. I don't know if you remember those.
Yeah.
That was a thing. So very quickly, we expanded our reach from being all about anti-aging, longevity, functional medicine to now people finding COVID testing locations because they couldn't travel without the test and the crazy things that have been happening back then. We also have seen a lot of growth in the mental health space. Everybody locked up. I think there was a big need for that. So that platform really expanded from being all about functional and integrative and anti-aging to these other areas. And, currently there's all kinds of different physicians and patients coming to look for help. It's a free service. It's free for patients. It's free for physicians. If you're a physician, you can just go on Vitadox, and that's Vitadox.com, and just get a free listing there.
Yeah, and I encourage everyone to do that. It looks like such a cool service, and I'm absolutely going to turn on some of my clients to it too, because it just looks like a really cool service. So that's so cool you brought that to market too. So what inspired you in the first place to even focus on the medical niche and specifically longevity anti-aging?
So going back a little bit, kind of going into 80s and 90s in my journey. When I was 5 years old, I was coding computers. So my background is not so much in marketing, but on the technical side, right? This is maybe back in the time where IT departments were responsible for websites. So that's where I come from before starting Web2Med and Vitadox and doing it professionally as a company. Medical has been always interesting to me. It's a great field to learn and absorb information for kind of my own sake, but a lot of my family has been involved with the field, mostly, kind of not so many physicians. um, Although my great grandfather had a hair salon. This is back in Europe, and I don't know if you know that, but back then they were providing some of the medical treatments as well. So
Wow,
that's part of it.
interesting.
Yeah, yeah. I wouldn't call him a surgeon, but they were offering some of that as well. This is back hundreds, long time ago. But my father was an inventor of medical devices and so forth. So I have been around medicine in one form of or another for a long time.
Wow,
So
that's so cool.
when I was a kid, I was creating websites, or maybe even before then, programs, always kind of that medicine was sitting in the back of my head. When I started creating websites and providing marketing, it was mostly, back then in thousands when you created 10 websites and you had a website and it was great. But medicine was always, again, kind of interesting to me from that perspective, just the history and the background. We started working early on with the American Academy of Anti-Aging Medicine. That's where that anti-aging connection comes into play. A4M is still our client. They have been providing great amount of education into that space. So really appreciate working with them and learning all about the latest and greatest in medicine.
Yeah, their A4M's awesome. I'm looking forward to going to one of their next conferences there. I mean, there's so many great longevity conferences nowadays. I just was at one in LA called Health Span Summit, which was awesome. I plan on going to RadFest, and then I know A4M has an excellent conference that I do plan on attending. So we'll get to meet face to face there, hopefully, when I do attend one of those.
No, yeah, no question about it. There is one coming up in West Palm Beach. That's the spring conference, and there is the big one in Las Vegas. That's in December. The great conferences to attend if you just want to learn about that industry, or attending lectures. They're focused on providing education for physicians. So I know with Redfest and some of the other ones, there is maybe that consumer angle, which is great. I mean, this whole
Definitely.
biohacking space,
Yeah.
it's almost like biohacking is for consumers and longevity for physicians, but it's not really great crossover between the two. But yeah, it's great educational experience if you want to attend their lectures and really learn about the latest and greatest. And you can't really keep up too. I mean, there is so much stuff coming out these days that it's
Yeah.
really hard to go to all the conferences and watch all the webinars, listen to all the podcasts. It's close to impossible.
Yeah, I mean it's just like and the newsletters too. I feel like there's just so much. And then I even just watched the latest movie called Longevity Hackers. I don't know if you've seen that, but watching that I'm like, "Oh my gosh, there's so many people in this industry that are coming up with really cool innovative solutions and ideas." And that was a cool movie that I got to check out, and just like, "Oh, cool. What's Novos up to?" Or, whoever was on there, and really got to connect with things. And then there's people like Aubrey de Grey, who I've talked to multiple times on there. And it's just a really cool movie. If anyone listening or watching hasn't seen it, I definitely recommend checking it out. So this brings me to something I'd like to ask you. What challenges that are unique to the medical industry, and maybe more specifically the longevity anti-aging industry, do you see in terms of like marketing and documentation and those things that clinics might be facing that's a unique challenge to them?
I think all the regenerative medicine stuff that's not necessarily FDA approved, I think that's a big challenge from the marketing perspective. Last thing you want to get is a letter from a state medical board or FDA or the FTC with them saying you either got a big fine or this is something you cannot do. So you have to be careful, right? Going back to those COVID times, I remember physicians getting letters because they had somebody sneezing and they had all this stuff about the immune system. Now, there is one way to put it in the words that will not get you in trouble. There is always a little bit of a gray area. So it's a matter how much you want to push the envelope and how far you want to be in that gray area. But there are certain things that, were on the radar for a very long time. Stem cells, exosomes, all of these new therapies that I think are proven and effective from what we see. And there is a lot of studies, but they're not necessarily allowed by the FDA in the US and frowned upon by a lot of state medical boards. You run into issues not just with the FDA, FTC state medical boards, but you run into issues with Google. You cannot run a Google ad because you are now talking about, let's say, GLP-1s, which are very common, but you need to get the legit script certification for that, which
Yeah.
has been taking longer and longer to get. But going back to Google, let's say if you're a clinic and you offer all the common FDA approved things, and all of a sudden you talk about stem cells, you may not be able to run Google ads for these common things because now you're talking about something that they don't deem as approved and safe, and they may put it in a category that you basically have to take it down to be able to do marketing.
Yeah, we face that. Oh, I was just going to say, I have a client just along with that thought is that they produce a natural testosterone booster, right? And it's got shilajit and maca and these things. And just the word testosterone just makes them flag. And you're just like, man, you can't get that thing anywhere close to Google ads because it's like, hey, this requires a prescription or whatever. And we're like, no, it's natural, But yeah, I mean, like you said, there's a lot of things that should be totally okay, but like especially with marketing, through marketing lens, like Google's like, nope, they'll put the smackdown on that. And then also, like you're saying, with the FDA clamping down on compounding pharmacies. I know we had a bunch of trouble with FDA shutting down TaylorMade, with some peptides and stuff like that because it's just like they're just trying to shut it down, and it's really unfortunate. And just touching back on what you said in the early, hopefully this next administration coming in will hopefully lighten up on that so more medicines that are cutting edge can actually get out to the people.
I think so. I really think, it has to change, have to be able to evolve. Now, I'm a firm believer in safe and effective treatments. I don't want doctors to be now promoting something that may not be good for the patient. That's the last thing we all want to do. But we see a lot of studies come out, and it then takes years for the FDA to approve things. Now, I get that drugs have to go through clinical trials and there's got to be a process, but nobody likes the bureaucracy, and that process, I think, has been broken. So I'm really hopeful that that will change. It probably is not going to change overnight. It's a process to change the process, but I think good things are on the horizon.
Yeah, I certainly hope so too.
Yeah.
Um,
Other
so
challenges, I mean, from aside from this legal stuff, really marketing a practice, I think a lot of physicians, this maybe it's not even so much about marketing the practice and getting more patients, but I think a lot of physicians don't have the business skill set that's required to run it well. So I always encourage, to look at the business aspect of the practice to be able to do it well. There are companies that help with that. We don't necessarily get involved with it, but the practice management part is tough if you don't know how to do it. To give you an example, if a patient calls and they ask the practice if they take insurance and they don't, and they get an immediate no, that's probably not the best way to handle that client or that patient calling in. So we see that a lot, especially if you do lead generation and you have patients calling in. There is a certain way to answer that call. And I think that takes a specific skill. to be able to do it well. A lot of practices kind of forget about that.
Yeah. So that brings me to one of my next points here, and this is kind of more of a, how would I say that, like something that a clinic potentially listening could execute on. How can a clinic owner or a doctor effectively communicate the value of their treatments that they're giving to potential patients?
Well, a lot of times the doctor can do that well, is that where their staff maybe are not trained and don't know how to answer that. So physicians themselves can get a lot of free education online how to do it. A lot of vendors will support them and provide that, but I think it really needs to extend to the whole team so that person that picks up the phone, that's kind of where it starts. Now, there are solutions, and we do offer one HIPAA compliant call recording. I know it requires time to listen to the calls, but not being able to do it a lot of times, especially with new staff, is where we see a lot of problems. I'm not saying that's everybody, but if you can eliminate even 10 or 20% of the problem, you're typically going to get 10 or 20 more percent of that business coming in. So it's time well spent. I would say physicians know how to talk to patients for the most part, but where the business part is failing is that they don't have the time or seemingly don't have the time to manage that staff. So these tools that allow them to maybe put some reporting and metrics on it, but then they themselves listening to the calls, I think they can change a lot of things and they can hear the little things that the person, if they recorded themselves, wouldn't necessarily hear because they don't know what they don't know. So I think that's one tool that's kind of effective way to be able to manage it.
Yeah, that's such a good point. A couple of the clinics that I've onboarded in the last couple of years, one of their things was reputation management, right? And you go in and look at their Google reviews, and the reason they're getting so many like 2, 3, 1-star reviews is all front desk related. You know, it's like, oh, the person was rude or they forgot to call me back. Nothing to do with the treatment, nothing to do with the doctors or the results they're getting, is all about that. And so that's such an important point that's easily forgotten, you know, because if the doctors are focusing on like, let's give the patients the best treatment, but really, like you said, it starts with that first phone call or first email response into the front desk and really making sure that that's a nice, easy, smooth transition where the people feel welcome, not intimidated, don't get a rude receptionist, et cetera, et cetera. But that's such a good point that's so easily forgotten, I feel.
Yep. And that really sets the tone, that first call coming in, that those first impressions do matter, especially if you will try to get patients on a premium service, hormone replacement, or these more advanced things, advanced diagnostics that probably are not covered by insurance and may cost a little bit of money. They're all worth it. It's just that you need to be able to speak to the patient and convey the benefits and why it's important, because I think times a lot of calls, the front office person may think that that patient knows everything that they do as well. And they may heard about, let's say, hormone replacement, but that patient may not know all the benefits. They heard it's great from Susie, but that's where it stops. And they need professional help and somebody to really guide them through it and hold them through the process. So I know it's maybe challenging and easy to say they need hand holding because that requires time, but I think that's an important point to always remember that that patient comes first, and they do want to be super educated. It's better to provide them that education up front and set kind of the path for them in a way where they can appreciate, that learning experience.
Totally. And just my last podcast that I recorded a couple of days ago, my guest, he was talking about there's the science and the scientist that's like, hey, here's the numbers and the stats, but there's also then the storyteller or the educator. And it's really important to fall on that storyteller educator side of the thing, because when you're speaking to a patient or a potential patient, that's really, like you said, is being educating versus the science based, because they might not understand. And a lot of those things might go over your head, even though you have a thorough understanding of what's going on. Most patients probably will not. So that's just a really good point that you brought up there too. So what strategies have you been seeing that have been most effective for your clients and the medical industry in general?
Well, at the end of the day, it's about ROI, right? So I think having a strong website, and it may sound obvious, but good website, it's where everything starts and ends a lot of time, right? You run a Google Ads campaign, that by itself may not be effective if that website is not built for conversion. And what I mean by that, getting people from looking at what you provide to actually having them book appointments or calling the practice. Key website is important, and I think few components that are important. It obviously has to look good, but looks sometimes are kind of diminishing returns. What I mean by that, you can make it the most custom and prettiest website, but if it's not going to have the right content on it, probably is not going to matter all that much. I sometimes see people really investing into that look while they're lacking the content. So content for me is key because as a patient, I want to be super educated. So I go and I want to get that education. I better get it from that website I'm looking at, or I'm going to a different one. Secondly, good content is important for search engines. If you don't talk about a treatment, Google will not pick it up, right? You will not come up. You don't have a chance to come up. Now, content by itself is maybe not putting you to the top of the search on Google, but without it, you basically stand no chance. So good website, just to recap, decent looking, good looking website that's feature rich to get that patient in the door, and then the good content to go with it is key. With content, there is obviously AI. Now, good and bad. It's a tool. We've been using AI tool to help our work for a long time, but we still have a team of writers. I don't think that's a skill set that's easily replaceable because AI will not always give you the results that are desired. What I mean by that is that you can go to ChatGPT, all the other tools, and try to generate content. If you don't know what that content should really look like, you're really not going to get great content out of it. Challenge with it is that Google does not like AI generated content. Now you could tweak it in a way where Google may not be able to tell, right? Because it's just words. So how does Google know? But there are
Mm-hmm.
certain patterns. If you don't know how to break out of those patterns, then it's going to be AI generated content or deemed AI generated content by Google. So content's got to be authoritative. I'm not saying not to use AI to assist you in that journey. It's great for creating a list of topics for your blog or even getting a structure to a page or getting, what are the most commonly asked questions about the specific treatment so you can then develop your own content. So that's sort of a challenge that I see a lot of times with physicians where they know they need content, so they'll take it from somebody else. Google does not like that. It's not an
Yeah.
authoritative content. It's not your own. Besides the legal end of it, that somebody could say that that's my content, I own the copyright. We don't really see that happening all that much, but it's not good for SEO. And then we do see now a lot of people going to ChatGPT and generating that content. And I don't have to put it through a system to tell me if it's AI generated. I can just read it and know it is because
Yeah.
I know what the patterns are. And if you have been using ChatGPT for a little bit, you know what that content looks like, or any of the other systems. I kind of put it under the ChatGPT umbrella because people know it by that name, but other systems kind of have their own patterns, and you can kind of see it right away. This is not content written by somebody. This is content written by AI. Like I said, it's a tool. It's a great tool. But just like any other tool out there, you have to know how to use it for that tool to be effective. To give you an example, I can swing a hammer. It doesn't mean I can build a home, or build a house. So ChatGPT is the same, right? I can ask it for things. If you don't ask it specific way, if you don't know how to swing that hammer, so to say, you're not really gonna get far with it.
Yeah. How we use AI in our agency, we use it fairly extensively too, but definitely not to write. The most powerful things that I find it for is for research and those type of things, and then always chat. But always, so like you said, you can see the patterns, and it's so obvious, especially when you're working with it on a daily basis. But really using it for a research assistant and really helping with like the H1 tags, the H2 tags, and kind of the technicality of SEO, and then really putting our writers to work making sure there's a story involved and it flows very semantically like that. And then also just kind of double clicking on the doctors and the content and getting found. One challenge that I always find is that people don't know what they're looking for, kind of harking back to Steve Jobs, it's like the customers don't know what they want yet. And I know, we're sharing what, before we started recording today, what brought me and what brought you to the longevity space. And one of the things I remember having on my vision board forever, having the presidential exam, right? Because I know like any president, has this really thorough medical examination. I'm like, one of these days, I want to get one of those like really thorough medical exams. And I didn't even really realize that that was actually longevity medicine that I was looking for. And so one of the things with our content is really finding the words that people might be searching for that's not necessarily longevity or anti-aging related, because the people don't know that's what they want or need. And it's really figuring out like, how do I get in the best health or whatever? And obviously you mentioned like the GLP-1s, a lot of people have a lot of interest to that. So that could be a lead in or a hook to get people into that space. But that's one challenge we find when writing. Like I can write about peptides and all kinds of stuff all day long, but if people don't know peptides exist or what they do, I can write about them. They'll never get found by the target audience. But if I'm targeting different phrases, that people will likely be searching for, that will lead them back to that article or website. And there's like, oh, of course, I need a longevity or anti-aging expert that really help me with my health span, versus, XYZ. So yeah, it's just an interesting thing about the content thing. It's that's why I find with the
Exactly right.
longevity, yeah, it's a kind of a tricky thing. It's not super straightforward. Like, hey, I need new tires for my car. It's like, what are you specifically looking for there? So talking about a little bit more on effective digital marketing strategies, because I want to make sure we give our listeners a lot of value as far as, if they don't talk to a professional like you or I, what can they do on their own to really improve their presence? And then I'm assuming most of these businesses are brick and mortar businesses. Obviously, there's e-com businesses out there in the longevity space, but I feel probably you and well, A4M may be an example, a different example, but brick and mortars is who I specifically um, focus on. What is some strategies that someone could apply today after listening to this podcast and just be like, okay, cool, let's get on this and really help boost their rankings and visibility online?
It kind of depends where the comfort zone is and tech know-how, but assuming that typical doctor will not know HTML, why should they know HTML? I know physicians that want to be super educated on everything they do, and some of them did learn. But it's a skill set that's kind of useless after a year because it all changes anyways, right? So what can you do as a physician to do it on your own? Maybe you're just starting. Website I would leave to professionals, but maybe developing that content. One thing that I think a lot of physicians could be doing but don't know how to do it, they haven't took the first step, is recording videos. Because even if you have a professional team, it's still you, the physician, that would preferably be on video. And it's really easy to do, I think, for the most part. Take your iPhone, don't buy, $10,000 camera, get a good microphone. It doesn't have to be too fancy. You can use one of the DJI products or, anything that's wireless or wired. But if the sound isn't there on that video, then that video would not be great to put anywhere. So invest in a microphone and basically talk to the camera like you would talk to a patient, and just talk about what BHRT is or what stem cells are or what PRP is, and develop content that way. Now, you get a couple of different things out of it. This is content you can put on your website, and I think the spans have been growing shorter and shorter. So a lot of people will prefer to watch a video. You also get some exposure on YouTube and Vimeo and other places you can put this video in. So those, in a way, do become search engines for people, either actively looking or just passively browsing and scrolling. So that short form content is kind of what I'm getting at. This is not developing half an hour BHRT lectures because probably not gonna get people to listen to the whole thing anyways. But 2 3 minute videos. Shorter the better, I would say, because you're not gonna get somebody listening for more than 3 minutes, probably not, at least on the initial visit on the website. And if you can talk about it for half an hour or an hour, then by all means record it and sell it to the people that want to listen to it. But now we're getting sidetracked a little bit. Now, this content, if you talk, you can actually transcribe it quite easily. So you can get written content out of it for your website as well. So that's something that I think is pretty actionable. Not many physicians do it. They think it's too time consuming, but mostly we see them trying to overthinking, writing scripts, investing into equipment that's never used. Just start doing it. After the third video, it's gonna become a natural thing, I think. So that's one. Another
Yeah.
thing that you could do as a physician or a medical practice is getting your Google My Business set up, and you can do other listings. There is obviously Yelp and so forth. But if you want to have that local presence, if you're a brick and mortar, then that local optimization, even it may not be the best optimized, you may not know all the little tricks and strategies, it's good to have those listings. If you're a telemedicine business, that's a little bit tougher, but for brick and mortar, you should have one for your practice and you should have one for each practicing provider. I wouldn't get it, maybe for the staff that's not somebody you would necessarily book an appointment with. Like if you have a MA or, a nurse there, don't go overboard. But if it's a practice with three physicians, you should have four listings. You should have the practice one, and you should have one for three of the providers. And it's not that hard to set up. It's, time. And if you don't have the time, hire a professional. It's not an expensive service for the most part, but that's something that can be easily done. Now, there is so many other strategies. And again, it comes to down to comfort level. There is social media. You could reuse that video content there. I think that's where it can become effective. Though social media is tricky because I think a lot of people are banking on it that they will show up, but unless you're running ads, you probably won't. The shortcut to it, you can post a lot, and that will get you a little bit of a visibility. But looking at how much time you need to spend versus the money you could spend on ads and other things, that time is taken away from treating patients and making money. So it's kind of, again, diminishing returns there. Not saying
Yeah.
social media is bad, but it's just hard to pull off if you know all the little tricks. At that
Yeah.
point, you just hire somebody to run ads.
Yeah, that and just tying that back into like the video piece, what I was going to say is that can seem so overwhelming to so many practitioners. And really, what I always recommend, especially if they're doing it on their own, just make that video and just focus on one platform. It can be just LinkedIn. LinkedIn just rolled out a great video feature that not a lot of people are capitalizing on yet that I've seen, but just focus on that. Don't worry about like, oh, I need to get on TikTok and YouTube and whatever. Just focus on one so it doesn't become overwhelming. Get consistent with that. And then once it's consistent, then you can think about like repurposing that content and then syndicating it with other things. But yeah, don't get overwhelmed. Just keep it the KISS, keep it simple,
Simple,
stupid,
stupid.
or
Yep,
something like that. It's like
that's the way to
that.
do it.
And then the second thing that you're just talking about with, oh man, I just lost my thought there, but basically
Local SEO.
oh yeah, the GMB. Thanks. What I also say too, yeah, get someone again like you or I, or there's a lot of GMB, Google My Business experts out there. But if you're doing it yourself, what I always say, and it's real helpful now because Google has that, percent, if it's 100% filled out, make sure that's 100, just put all your hours, make sure if you have handicap parking, there's some Q&A, make sure to put some text, fill out all that stuff because Google loves it when you use their products to their full extent and they reward you with that. So just always fill that out to the fullest extent you can. It's really simple. It just takes a few minutes, but that mileage will go a lot farther than just like putting your stake in your flag. And I love your point about every single provider in their service. If they have multiple providers, PAs, whatever, get them a Google My Business listing. That's such a powerful thing. And what I always tell clients, I liken it to, I call it the Oreo cookie example, right? So when you go down your local grocery store and you look at the cookie aisle, there might be some awesome like homemade cookie, Mrs. Smith's or whatever. But if there's only one flavor of that cookie, that only takes up that much space on that aisle. But Oreo, man, they've got double stuff, they've got fudge, they've got birthday cake, blondie, et cetera, et cetera, et cetera. And you look and there's tons of Oreo. So it's the same thing with the digital footprint. The more
Great
you're out
analogy.
there and the more things you put out there, you're creating a bigger footprint to get noticed greater. And that's always my analogy that I always tell my clients. It's like, just think of it like the cookie aisle in your store. You want to be the Oreos of the digital marketing. You want to come up with every flavor, every brand, create a SKU for it or whatever you need to do. But if you make those things, that just will create a larger footprint online. And it's just such a great thing. But like you said, it's such a great reminder. It's like, it's probably so easy to forget or just not even think about, but make a Google My Business profile for every single provider that you have in your office. That's golden advice, Phil.
It doesn't take that much time. One tip in there when you set it up, make sure that name, address, and phone number matches to what's on your website exactly. A lot of people overlook that. And Google is pretty smart, right? It can figure out the little intricacies, but this information is almost like a glue for this local area between the different websites. So if you do decide to spend the time and do it on your own, make sure that stays the same everywhere you put it. There is no reason to do it differently, but we're all kind of guilty. We just type in stuff. I type it here this way and there a different way. The file, copy and paste it. Don't change it, if you will. And now there are call tracking numbers and other intricacies that may come into play. Don't worry about it. Get it as best as you can, but make sure that address is spelled exactly the same. And I always suggest go to Google, put your address there, see what Google spits back out at you, and use that. Use that format. Don't try to guess, if you put ST or street or however else. See how Google basically presents your address and use that.
Yeah, that's such good advice too, because it's funny that it's seemingly such a small thing. It's like, what's the difference if I put brackets or dashes in my phone number or use multiple phone numbers, or we're just in unit B now. We used to be in a unit A or whatever. It's like that stuff matters and it's super important. So that's a great little tip there too. So Phil, I'm about to wrap this up here. This has been full of actionable advice.
We could talk forever. There's so many different things,
Oh my
right?
gosh, yeah. Yeah, this could be a 5 hour thing, but we got to respect each other's time here. We've got clients to service, et cetera. But what I'd love for you to share is how can listeners and people watching this get a hold of you and learn more about either the Vitadox or your web to med services, or just you personally? Like, is there LinkedIn, social medias, websites?
LinkedIn, Philip Kujawski. So if you just look up my name on LinkedIn, I have pretty unique name, so I'm probably the only one in the digital marketing space,
And
or
just
maybe the only Philip. There may be other Philip Kujawskis there, but if you look me by name on LinkedIn, you can get a hold of me there, or you can go to my website, web2med.com. That's webtomed.com, or Vitadox is Vita, Vita, Docs, Dox.com. And you can get your free listing there. Just search for your name. You are already on Vitadox because we pull data from public and private databases. If you're a practicing physician, you'll have a listing, but it's going to be basic and probably outdated information.
Yeah, so go claim that, because that will be just a valuable backlink just in itself. So, I mean, if if you just want one little thing to improve your SEO, get a backlink, go to Vitadox. Yeah, for sure. That's awesome. Well, Phil, thanks so much for joining us today. I really appreciate your time, and thanks so much for the awesome information. And then with that, thanks for tuning in, everyone, and we'll talk to you next time. Cheers.
Thanks, everyone. Thanks.
You're welcome. This is the Longevity Loop Podcast.